So it's quite difficult to describe my typical day at work because it really is a job where every day is different. Um, it's fast paced and there's loads of variety. But generally, my day is broken up into three parts: a morning surgery, a middle of the day, and an afternoon surgery. And so, starting with the surgery will be a mixture of face to face appointments, appointments on the telephone, and e consult appointments. So, that's an email based service that we also offer. And with regard to what sort of things we might be doing, well, that varies massively too. Um, that I could be, yesterday, I spent the day going from one consultation about fertility issues and then mental health, and then from there on to cancer based investigations and cardiology, and then some children's health. So I really love the fact that I've got so much variety in my day. The middle of the day, I'll grab a bit of lunch and then get some paperwork done. So that might be reviewing results of blood tests, x-rays, other investigations. I might be reviewing letters that we've received back from the hospital. And I also might be going on home visits to patients who are unable to leave their house for some reason. So, for example, on Friday, I went to visit an elderly gentleman who's bedbound and needed an assessment of his chest, and a discussion with his family. But also during that middle of the day part, I might have meetings with other colleagues. So again, an example from yesterday, I had a palliative care meeting where I coordinated with our palliative nurse specialists and our district nursing teams and other colleagues from our team to make sure that we're offering the best care possible for patients approaching the end of their life. And then from there, afternoon surgery, similar setup to morning surgery, mixture of e-consults, face-to-face and telephone consultations, again with that real massive variety in day-to-day work. So that's going to be taking information from patients, learning about what their problems are, and then maybe doing an examination or ordering some tests. But probably the most important part of that is talking with people about helping them to understand their problem, understand maybe what they can do to help their problem or what we can do to help them with it. There are other parts of my work as well. So I also support the other staff in the surgery. So I might be answering queries from our nursing team or our practice physiotherapist. I have a role in teaching and training our doctors of the future. So that might be medical students, doctors in their early training who haven't yet chosen a career path, or it could be doctors who are training to become GPs. And then we have a role in service development, and some GPs also own the business as well. So there's a business management aspect there too. What do I enjoy most about my job? Well, I think firstly, it's the connection with people. We develop long-term relationships with our patients in general practice, and that can be really rewarding. I really enjoy seeing my work actually help people. So that might be seeing someone who has been through their treatment and is improving in either their physical or mental health. It might be supporting someone to make changes to their life that make their health and well-being better. And sometimes even when you can't make things better, you can make life more enjoyable for people. So I think it's that real focus on seeing improvement. I also really like being part of the local community, and the fact that we can coordinate with our other health support services in the community is really valuable to me. So that might be working with our colleagues in community pharmacy, or it might be working with our district nursing colleagues or our optometry colleagues. And like I say, those relationships are really valuable to me. And the other thing that's lovely about my job, I have a really lovely team of people that I work with, and we all have a real shared goal with regard to supporting our patients and supporting our communities. My path into my career was fairly direct. I went through the traditional A levels, off to university for a medical degree, junior doctor jobs and then into specialty GP training. But not everyone comes to their career that way. There are access to medicine courses that can get you onto that career path into medical school. There are postgraduate medical courses now, which are a good option for people who have done a degree in a relevant field. And there are also now options for once you are out of university for less than full-time training. So I think whilst my route was very traditional, there are lots of other ways to get into a career in general practice medicine too. What advice do I have for people considering a career as a GP? Well, at first I'd say it's hard work, it's emotionally challenging, and the training's really long. But the upsides are so worth it. So it's an incredibly rewarding career. It gives you great variety in your work and you're never going to be bored. So those things I find really important to me. With regard to what you need to get into this career, I think you do need a solid academic foundation, but more importantly than that, you need to be able to connect with people. And you need to be really good at looking after yourself as well in this sort of role.